Without a heartbeat or respiration, a person is considered clinically dead. For people who collapse on a day-to-day basis, they are most commonly surrounded not by doctors, not by nurses or paramedics, but usually by ordinary citizens. So now think, what if you came across someone who was unconscious and unresponsive? What would you do? Most people would go run for help or call 911, which are all very useful and advisable steps. However, along with getting assistance, you can also perform a procedure called cardiopulmonary resuscitation, which is also more commonly known as CPR. There are three main steps to follow while performing CPR, and which includes: one is scene safety and calling for help. Two is doing the 30 compressions, and then the third step is the 2 cycles, 2 rescue breaths. The procedures I'm about to go through with you have changed somewhat over the years. In the Harvard Heart Letter article titled "Streamlined CPR Guidelines, a Life-Saving Move," it explains how the American Heart Association made a radical change to the recommended CPR process for victims of cardiac arrest. The American Heart Association changed the recommended sequence to deliver chest compressions before airway opening and rescue breathing. This change will make more sense once I go through all the steps of CPR. Now, if you decide that you are going to attempt to perform CPR on this unconscious person that you just found, you first need to quickly and safely make sure there are no dangers to yourself or the patient. For example, is there a car exhaust running, maybe a gas stove? Is there a fire? If there is anything that could endanger you or the victim, see if there is something you can do to fix or get away from the problem. Maybe you can open a window, maybe you can turn off the stove, or maybe you can put out the fire if possible. But if there's nothing you can do to avoid the danger in order to perform CPR, you need to move the patient. Professionals recommend that the best way to move the patient is by placing a blanket or coat underneath their back and pulling on the coat or blanket. Try to be careful not to disturb the person's position laying down, because it might further cause harm. If you are alone, then call 911 immediately after moving the victim from danger. If there are bystanders around, then send someone to get help and to order them to find an AED as soon as possible. An AED is an apparatus used to produce defibrillation by application of brief electric shock to the heart on the chest wall. This device is designed to be easily operated by anyone, and once professional help is on the way, you may proceed with the CPR steps. Once you and the victim are in a safe location, you may continue with CPR. Your next step, which is a pretty obvious one, is to check if the person is conscious. You can do that by getting down on the floor with them, tapping their shoulders or shaking them, and saying in a loud, clear voice, "Are you okay? Are you okay?" Obviously, if they respond, then they don't need CPR, and they probably need just further medical assistance, which hopefully if you call 911, they're on the way. But if they do not respond, then you need to, your next step after you determine that they're not conscious is to check their pulse, and the 2 pulses are the carotid pulse, which is located on the neck to the side. And to check that, you want to take your first 2 fingers and place it on there and feel for a beat. Now, the other pulse that you can check is the radial pulse, and that is located thumb side of the wrist. And you also take your first 2 fingers and place that right here. Feel for a beat. Okay, once you determine if they have no pulse, your next step is to place your 2 hands on each other and place it on the sternum, right? And now you do that, and then you will be doing 30 compressions at a rate of 100 compressions per minute. And to do that, you do this. Place it like that. Count 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Now obviously you would do to 30. Make sure you have your elbows locked or pushing straight down at least 2 inches deep on the chest. and then make sure that the chest is recoiling as you're doing the compressions. After the compressions, you want to place your hand on the victim's forehead like this, and then take your two fingers of the other hand and raise the chest. Now you're going to bring your ear down to their mouth and listen for breath, feel for any air coming out of their mouth, and look for any chest rise. After you see, if that's not possible, then you're going to continue with the compressions after you give the two breaths. Oh, sorry. Oh, crap. Alright, and excuse me. This is my visual aid that I'm going to use. It's a breathing barricade basically, and on here it says this side up, so this side obviously goes in the mouth. So what you do is do the head tilt chin lift like I showed you earlier. You're going to place this in their mouth like so, and make sure you only put it in when you're about to breathe, because it will obviously suffocate them otherwise. So you do the head tilt chin lift, then you're going to give them 2 breaths at 1 second each. Alright, then you take it out, so don't leave it in there. And then you do compressions again at 30 rate, and then you go back to 2 cycles or 2 breaths. And then after that, you want to do that for 2 minutes, switching back and forth. Usually you get around 5 full cycles. And if nothing has changed by the time 2 minutes have gone by, you want to continue until someone comes and helps you. The only time you can stop or should stop if someone takes over for you, you have emergency personnel arrive, you are too exhausted to continue, or an AD is available for immediate use. I believe CPR is essential when someone's life is at stake, and can be very rewarding knowing that you have saved their life. Because of your new knowledge of these simple steps, you can become the vital link in an emergency such as that described in my introduction, and you can help save a life. Thank you.